The theater module streamlines the management of surgical procedures by ensuring thorough documentation of operative checklists and operation notes, ultimately improving surgical care and operational efficiency. To record theater notes, navigate to the clinical module and select theater. The theater panel will appear as shown for you to record theater notes. On the theater panel, view the Theater Requests section, filter the pending requests and choose the relevant dates. Select the patient from the list. You can use the search feature to search for the patient. In the Theater Request Operation Notes section, the requested operation is indicated in the operation field. The operative checklist is a critical tool used in surgical settings to enhance patient safety and ensure that essential steps are followed before, during, and after a surgical procedure. To fill in the operative checklist, click on Actions and select Operative Checklist. Select the type of operative checklist you wish to fill. The pre-operative checklist is a set of tasks performed before surgery to ensure patient safety and readiness for the procedure. The intra-operative checklist is used during the surgical procedure to enhance safety and communication among the surgical team. The post-operative checklist is conducted after surgery to monitor the patient's recovery and ensure proper care. Select the checklist category from the drop-down menu. If the category is not available on the list, click on the Add button to add it. Fill in the operative checklist description. Give a remark. Indicate the nurse's name. Select the role of the nurse and give a comment. Click on Save. Select another checklist category. Fill in the details and save. After filling in the operative checklist, you can record the operation notes. The operation field identifies the main surgical procedure performed. Indicate the specific operation to provide additional detail about the type of procedure conducted, ensuring clarity regarding the surgical approach. Record the name of the primary surgeon, establishing accountability and reference for follow-up care. Document the name of the assistant surgeon, promoting clear communication about the surgical team involved. Identify the anesthetist responsible for administering anesthesia, ensuring continuity of care regarding the patient's anesthetic management. Specify the type of anesthesia used, which is crucial for post-operative monitoring and patient care. Record the name of the scrub nurse, ensuring accountability for the instruments and maintaining sterile conditions during surgery. Document the medical diagnosis prompting the surgery, providing context for the procedure, and aiding in post-operative care. Specify the surgical incision made, which is important for future reference, including healing assessment and potential complications. Indicate whether any tissue samples were taken, which is relevant for pathological analysis and diagnosis. Describe the steps taken during the surgery, providing a detailed account of the operation for future reference and quality assurance. Record any complications that occurred during the procedure, critical for patient safety and future surgical considerations. Include details about the patient's response to anesthesia and any intraoperative issues, which are vital for postoperative care on the anesthetic notes. Provide an estimate of blood loss during surgery, important for evaluating the patient's stability and need for transfusions. The doctor's field reiterates the primary physician overseeing the procedure, ensuring clear accountability and communication. Record the date and time when the operation was scheduled, aiding in surgical scheduling and tracking. Confirm that all instruments and materials used during the surgery have been accounted for, preventing retained surgical items on the theater count field. Check the box Operation Completed to indicate whether the procedure was completed, which is essential for the surgical workflow and patient care continuity. Click on the Save button to save the notes successfully. To view completed theater requests, go to the View section. In the drop-down menu, select Completed. You can filter the dates as needed to access specific requests from a particular time period. Then click View. You can also choose to view all requests or canceled requests. To view the procedure report, navigate to the top right corner of your screen, click on Actions, and select Procedure Report. In the report window that appears, you can perform the following. Share the report via email. Save it in various available formats. Print directly from your browser. Still on Actions, you can perform the following. View theater pre-operative checklist report. Add a prescription item, bill services, and consumable items. Furthermore, you can select the consent form for the patient to sign. Lastly, you can edit the saved notes once an operation has been marked as complete by selecting Unlock Theater Request. Click OK on the prompt that appears.